Hey guys, welcome back to another Surgical Tech Tips. Today's video we are talking about tissue specimens. The tissue specimens and the role that the surgical technologist plays with tissue specimens at the field. But first I want to break down what the tissue specimen is and why we take them. And with that, I'm going to go ahead and call on the help of my good friend Dr. Arnold Chung, and hopefully he'll explain to you guys a little bit better than I can.
Hi everyone, I'm Arnold Chung, friend of Shane. I work in the operating room. So in terms of specimens, basically it's the problem of diagnosis. So sometimes a patient has a problem, but we still don't know what the problem is. So, if they have a mass in their lung or something in their breast, it's causing a problem. Therefore, we need to figure out what the issue is. And the best way to do that sometimes is to get a piece of tissue and send it to the laboratory for analysis. There's a saying, tissue is the issue, meaning sometimes you have to get a piece so that we can understand what's bothering the patient. Now, there are different types of tissues. Obviously, there's breast tissue, lung tissue, colon tissue, any kind of tissue, skin tissue, everything you can imagine. And our job is to get some tissue, get it safely, get it with minimal pain, minimal collateral damage, as they say in the military, and then send to laboratory. Different types of tissue have different kinds of results. Sometimes there's a patient that has an infection and you're trying to get cultures, which will show us what type of bacteria is affecting the patient so that we can give them the right antibiotics. It's a similar situation with different types of fungus. Sometimes people get fungal infections, and so you want to get tissue for that type of analysis. In a more serious case, though, patients will have cancers. So, the only way to sometimes diagnose if someone has cancer is to get a piece of tissue and send it to the laboratory. And the testing of the cancers nowadays is so sophisticated that they need plenty of tissue in order to do all the number of tests that they typically do to see if there are any genetic mutations within that cancer, because there's so many new chemotherapeutic drugs that can be applied to help patients with specific types of mutations. So no one person's cancer is the same as another. So person A and person B both have lung cancer. It can be totally different and have totally different outlooks from a survival standpoint. So it's very important that each person gets a tissue specimen if necessary, so that we can directly treat their disease as closely as possible. It's part of personalized medicine. Everyone gets a personalized treatment.
And that'll kind of help you determine what kind of like immunotherapy drugs to give. And
yeah, absolutely.
Awesome.
So
thank you.
That's what we do. So surgery, is often thought of as being curative, as being treatment oriented, and certainly it is a lot of the time. But sometimes surgery can be diagnostic, meaning we don't know what's going on here, so we need a surgeon to help us figure that out.
Absolutely.
So that's why we need some tissue specimens.
Awesome. Thanks for your time, man.
Okay, of course.
All right.
See you later, Bob.
All right. See ya.
Thanks.
Well, there you have it. So tissue specimens can be either fluid or tissue. Let's talk about a few different methods that surgeons utilize to take those biopsies. Number one is a needle aspiration. Needle aspiration could be something like a thoracentesis or pericardial centesis, where it's a really big long needle and a syringe, and they poke it through the skin and find the fluid and aspirate the fluid out of the area of the body. Or it could be something as simple as a small hypo and maybe like a fluid filled blister on somebody's skin, and they'll just poke that and take the fluid out for a biopsy. Number 2 is an incisional biopsy, and that's basically when the surgeon is going to be incising the lesion, and they're just going to take like a portion of the tissue and send it out for specimen. Number 3 is an excisional biopsy. Excisional biopsy is basically like removal of an entire tumor or removal of the entire lesion itself. So it's like en bloc, the entire tumor itself sent out for specimen. Very important thing to note here is when taking these biopsies on the field, you, the surgical tech, should have the available supplies for the biopsy. Number 1 for tissues, TELFA. It's basically just a non-adherent pad. I never should you give somebody a Raytec to put a biopsy on and hand off of the field. Never a Raytec. Always use a non-adherent pad, specimen cup like this, or if it's some fluid, we just have a fluid mucus trap. So there's 3 main ways to determine the diagnosis of a specimen. In the OR, we usually hear things like the frozen section or the fresh frozen section, the permanent specimen, and sending a specimen out for cultures. So starting with the fresh frozen section. Fresh frozen section means that you are going to be sending a piece of that tumor or piece of that tissue directly to your pathology department in your hospital as a fresh specimen. You're taking that tissue, it's going on a piece of TELFA into a specimen container and sending it out immediately. No saline, no formalin, no type of fluid inside that tissue. It's just a fresh section for them to take, and they will freeze it in the pathology department, look at it under a microscope, and determine the diagnosis, or as best they can. It's not always 100% accurate with a fresh frozen tissue sample. That's why we also take permanent specimens as well, and the permanent specimen is obviously more than likely it's going to be, you know, the entire excisional biopsy, the entire tumor. You know, the fresh frozen section is just a piece of that tumor. The permanent specimen that they are getting is going to be the entire thing, and it's going to be placed in formalin in a container, and usually it's sent out to be read at another facility. Now the third way with the cultures is really to help determine if the tissue is in fact a cancerous tissue or if it's just an infection. So we're sending that tissue out for cultures, so you're trying to find out if it's, you know, aerobic, anaerobic bacteria, fungal infection, gram stain positive or negative. Those things will help determine the diagnosis with culture swabs, or, you know, just sending a tissue to pathology for cultures. Alright, for this last part of the video, I wanted to talk about the surgical tech's role in the specimen. So the surgeon's up at the head of the bed, they excise the piece of tissue, hand it off to the surgical tech. The surgical tech, as they take the tissue specimen and put it in their cup or, you know, whatever device they have on the field to hand off the specimen with, you have to confirm with the surgeon immediately where this tissue came from. The surgeon will tell you, you know, this is a left breast tissue biopsy, or this is a right upper lobe wedge resection. They will tell you the exact anatomical, you know, location of this tissue specimen that they are giving you. Every now and then when you do a biopsy, especially in breast surgery, I see it a lot when they're doing a biopsy in breast surgery, to help determine or help clarify the exact location of the biopsy itself. They'll put a couple silk stitches in the tissue sample. They may throw, you know, one medial and one superior, and they'll say, you know, cut the superior one long, cut the medial one short. So then when you take your specimen, you're handing it off the field, you're confirming with the nurse the exact location of the specimen. This is a right upper lobe wedge resection. This is a left breast biopsy. Markers are short silk stitch is medial, long silk stitch is superior. So you're confirming again with the nurse as you're handing off the specimen itself. And then again, we're confirming at the end of the procedure. We do kind of like an end timeout of the procedure, and the nurse will confirm all of the specimens that we have taken for the procedure, just to make sure that we have all the right specimens. Now there's a big reason why we have to double check, triple check all of these specimens and all of these confirmations. You know, the surgical tech confirming with the surgeon, the surgical tech confirming with the nurse confirming with the surgical tech and the surgeon at the end of the case. You can, I mean, we're all human, okay? Humans make mistakes, but you do not want to make mistakes with specimens. If you lose a specimen, if you mislabel a specimen, those types of things could make a patient have to come back to the OR to get another biopsy because of a mislabeled specimen or a specimen that's been lost or something like that. You really have to pay attention when it comes to specimens. It is paramount. Thank you guys so much for watching the video. Please let me know if you liked it below, and if you have any other input that you want to share about specimens, please put it in the comment section below. I'll see you guys again. Bye.